Marc, we've got David Blye back. Why don't you go ahead and kick us off, and then I'll bring up our first Menti question.
Okay. Good afternoon, everybody. Thank you for joining us. It's nice that you all are here, although in this format I can't see any of you, but I trust that you're all there somewhere out in computer land. The topic for today is PFAS, which I think many of you who are here have had some exposure to it in terms of your work, have heard about it, but it's a very important topic as we move into the next phase of environmental protection and public health protection. As you'll hear more today, PFAS is a class of chemicals with widespread usage throughout the world that offer unique properties that were in demand across numerous industries. Over the past decade or so, the environmental and human health impacts of PFAS have been studied, bringing this class of chemicals into a new focus. Hollywood took a crack at explaining the issue in a 2019 film, Dark Waters, and the media has been very active on a wide variety of fronts. In response, in April of this year, EPA formed the Council on PFAS to develop a coordinated public health response to the information that's being generated and the pervasive presence of PFAS in the environment. Pat McDonnell, some of you may know, is the Secretary of the Pennsylvania Department of Environmental Protection. He also, at this time, is the president of ECOS, which is the Environmental Council of the States. And he described the PFAS issue as, quote, the most complex environmental challenge facing the states today, indicating that it will take close coordination and partnership across all levels of government to tackle it. Congress is deliberating specific PFAS legislation this week, and the states are passing laws banning certain firefighting foams and phasing out the use of PFAS in product packaging. Maine and Connecticut joined this group of states with new PFAS legislation this month. In addition to this attention, some are claiming that the presence of PFAS in the bloodstream limits the effectiveness of the COVID response. Vaccine, which is obviously a new analysis and a new argument in terms of raising the level of interest in PFAS. So against this backdrop, the WRA, in cooperation with environmental standards in particular and others, led by Skelly Hombeck, our executive director, put this program together to provide a documented perspective on several important aspects of the PFAS issue that pertain to this region. It's an important discussion because through these presentations, you will hear some of the analysis of issues in the Delaware region, in the Delaware River, and in this part of the country, as well as some perspective on what's happening across the country with some technologies that are emerging in terms of how to deal with the PFAS issues in the environment. We'll introduce the speakers in a few minutes, but first, before we get started, Skelly has a few questions for all of you to answer so that we can get a sense of who you are, what your experience has been with PFAS issues, and we can build on that as we go through the discussion. Skelly? While Skelly's finding her way into the audio portion of the program, and Skelly, you can interrupt me at any point. Let me take this time, I was going to do this after the questions, but I can now give you a description of the speakers. We're very proud of this panel, and I wanted to talk with you about what their backgrounds are, the order of presentation, and how we're going to wrap up this program at the end. Kicking off the discussion is Preston Luitweiler. Preston is a registered professional engineer in Pennsylvania with a BS in civil engineering and an MS in environmental engineering, both from Drexel University. He retired from Aqua America in 2013 as Vice President, Chief Environmental Officer after 29 years with the company. At Aqua, Preston was responsible for water quality and environmental compliance for operations in 10 states. Preston now is the Assistant Treasurer of the Water Resources Association of the Delaware River Basin, the group that you're here to hear from, a lifetime member of the American Water Works Association, and a member of the American Society of Civil Engineers. Preston will be kicking off our discussion. Preston will be followed by David Blye. David is a principal chemist with environmental standards located in Valley Forge. He holds an AAS in Ecology and Environmental Technology from Paul Smith's College and a BS in Environmental Chemistry from SUNY ESF. David is a subject matter expert in the analytical and environmental chemistry of PCBs, dioxins, furans, and PFAS. Those of you who might have been tracking over the years the PCB TMDL, David was one of the key experts working to establish that regulatory scheme, focusing in on the analytical challenges for PCB sampling. Following David is Greg Cavallo. Greg is a registered professional geologist in Pennsylvania. He's the principal at Cavallo Environmental Services and has more than 25 years of diversified experience in the environmental field with a focus on environmental chemistry of emerging contaminants. He has developed contaminant monitoring programs with a focus on source identification, data management, and implementation of novel remedial approaches for emerging legacy contaminants. And batting cleanup, with no pun intended, although that will be her topic, is Amy Dindal. Amy is Battelle's PFAS program manager. She's responsible for setting technical direction and oversight of a multidisciplinary team of more than 50 staff that include scientists, engineers, chemists, biologists, toxicologists, and modelers, developing new technologies for PFAS remediation, treatment, assessment, and monitoring. Amy holds a Bachelor of Science degree in chemistry from Penn State University and has been a certified project management professional since 2006. So those are the presenters. That is the order. We would be ready to go unless Skelly can find her way on.
I do, I'm back.
There you go. Welcome back, Skelly.
All right, I've got a couple questions for folks. We're going to use something called Menti, and we've got questions at a couple different points in this presentation. All right, water and wastewater supply, consulting, legal, other. I think I know what our other is. All right, water user, so that could be power production, industrial or shipping. 2 folks in the other category. So this is open-ended. What would you like to get from this session? And there might be something in particular that's technical that you would like an answer to. Might be more on the regulatory side. Perspective. You'll definitely get perspective, potentially 4 different perspectives. A better understanding of work that's going on. Fantastic, thank you so much. Excellent. What are the business opportunities? What's happening in remediation? Toasting Mark. Understanding the data, that's a fantastic point. What's happening on the regulatory front? We've got a couple different states in play here, as well as the EPA. Generally developing more knowledge. What's happening with regulations and where are they headed? Thank you all so much. This is really helpful to our panelists. We are glad you're here. We've got A lot of good expertise on the call as participants. So I will monitor the Q&A and I will monitor the chat. So if you've got questions, pop it in there and I'll let Mark know. Thanks so much, Mark.
Okay. Thanks for the feedback. It's really helpful as the speakers go through their presentations to focus in on what it is you want from them. And as Skelly said, we'll be open for questions and we'll manage the questions as we go. But now that you know the roster of speakers and the order of the speakers, Preston, I'm going to turn it over to you to kick us off.
Okay. All right. As Mark mentioned, I'm Preston Luitweiler. I was Chief Environmental Officer at what is now Essential Utilities, and I've served on the board of WRA for almost 30 years. I've been following the reported occurrence and regulatory initiatives, analytical methods, and implementation of treatment for perfluoroalkyl substances, or PFAS, and treatment for those substances for more than a decade. These compounds have received a lot of attention in recent years, and to kick off our program, we'll try to give a very brief description of the compounds, how they get into drinking water and into our bodies, and how they are being studied and monitored, and what is being done to address the issue. Out of hundreds, actually 4,700 PFAS compounds that have been identified by the National Institutes of Health in 2018, there are two of them that have received a lot of attention, and that is perfluorooctane carboxylate, or PFOA, perfluorooctanoic acids, another name, that's where the PFOA comes from, and the other is perfluoroalkyl sulfonic acid, or PFOS. The first PFAS compound, PTFE, was created in the 1930s, and it's still in use for Teflon coatings and Gore-Tex fabrics. A decade later, PFOS was introduced for stain-resistant products and later used in firefighting foam. A decade after that, PFOA was produced and used for protective coatings and things like microwave popcorn bags. In 2000, the US EPA and the sole US manufacturer of PFOS announced that the manufacturer would voluntarily phase out and find substitutes for perfluorooctanyl sulfonate compounds. The company ceased manufacture of PFOS and related compounds by the end of 2002. So this is very important to remember, that PFOS has not been produced since 2002. In 2006, the US EPA investigated major fluoropolymer and fluorotelomers and asked manufacturers to join in a global stewardship program to commit to working toward the elimination of these chemicals from emissions and products by the end of 2015. 8 companies committed to the 2010-2015 PFOA stewardship program, as it was called. In 1999, the National Health and Nutrition Examination Survey started measuring levels of PFAS compounds in blood in the US population, and they found them everywhere. Since 2002, when production and use was curtailed, the levels have declined substantially. From 1999 to 2014, PFOS levels in blood decreased by 80%, and levels of PFOA have decreased by 60%. And Greg Cavallo is going to expand on this with some more recent data and some information on what's happening out in the environment with PFAS compounds. There have also been some intensive and extensive public health studies conducted, the largest being the C8 project in the Mid-Ohio Valley, which cost over $70 million and monitored 69,000 people who were tested for blood serum levels of PFAS compounds, mostly PFOA and PFOS, and monitored for 7 years for potential health effects that might somehow be correlated with blood serum levels of PFAS compounds. The highest levels of both PFOA and PFOS were found in blood of workers in Minnesota in 2000, with a geometric mean concentration of over 1,000 micrograms per liter. That's a geometric mean. That means that there were some people with concentrations in their blood much higher than that. The geometric mean levels in the general public have been in the single-digit microgram per liter ranges for both PFOS and PFOA. US EPA issued health advisory level standards for several PFAS compounds in 2016, but EPA has not promulgated a drinking water maximum contaminant level for any PFAS compound. And in the absence of federal drinking water standards, several states have started the process of creating their own standards, with New Jersey leading the pack. This chart summarizes the status of health advisories, media-specific concentrations, and maximum contaminant levels that were in effect in the Delaware Basin in 2018. New Jersey proposed drinking water MCLs for PFOA at 14 nanograms per liter or parts per trillion, and PFOS at 13 nanograms per liter, and promulgated final standards for these compounds and for another one, PFNA, in April of 2020, just a little more than a year ago. 7 other states have implemented drinking water standards for various PFAS compounds since then. This table is courtesy of Environmental Standards, and David Blye will go into more detail in his presentation. You don't have to look at all the numbers, but there's a message here. This is the same data, a little bit presented a little differently, with the actual standards on the top and other health advisories and other standards listed below, or pending standards. And the important takeaway here is the regulations are all over the place in the state. Some states are following, for example, while the US EPA is the health advisory limit of a combined 70 parts per trillion. Connecticut expanded that to say 70 parts per trillion total for 5 compounds instead of 2. Vermont has said 5 compounds total, 20 parts per trillion. Measure them all, add them up, you can't be above 20. Other states have been very specific. Michigan has regulated the most in the number of compounds, and they've set limits at 8 for PFOA. This is parts per trillion now, really no small numbers. 16 for PFOS, 51 for PFHXS, and on to, with other compounds, 370 for Gen X and PFBS at 420. So there's a very wide variety of regulatory approaches among the states. I mean, you can look at with some of the states. Colorado, for instance, has a narrative standard, and they've picked 700 for PFH.X and 400,000 for PFBS. So Pennsylvania has had its own response following EPA's publication in May 2016 of a final health advisory level of 70 parts per trillion for combined concentration of PFOA and PFOS. Pennsylvania DEP developed a strategy to address PFAS, and in September of 2018, Pennsylvania Governor Tom Wolf issued an executive order to establish a PFAS action team. Sounds a little bit like EPA's current task force. DEP identified 26 sites across the state with evidence of PFAS contamination. 17 of these sites were in the Delaware Basin. So that's concerning to those of us who are in the Delaware Basin. In the absence of federal drinking water standards, DEP also embarked on a process to establish state-specific MCLs for PFAS compounds. So on May 8th, 2017, this process was moved along a little bit by a petition that was filed by an environmental organization to the Pennsylvania Environmental Quality Board, demanding that a drinking water maximum contaminant level be set for PFOA and that it be set at 6 parts per trillion. The petition was considered, wasn't rejected out of hand. It was considered by the EQB at a meeting on August 15th, 2017, and they set off on the process of setting a standard. Pennsylvania Department of Environmental Protection had never set a drinking water MCL before. They had always relied on federal standards. They set out to work with the Pennsylvania Department of Health to contract with a toxicologist to perform work to support the MCL setting process. And their goal was to promulgate standards by 2020, but of course that didn't happen. And let's not forget that a little thing called COVID-19 happened between March of 2019 and 2021. While the Pennsylvania Department of Health attempted to hire a toxicologist, Pennsylvania DEP contracted in July 2019 with Drexel University to develop recommendations for maximum contaminant level goals for select PFAS compounds. Drexel submitted their report in January 2021, just the beginning of this year, with recommended MCLGs, maximum contaminant level goals, for 7 PFAS compounds. And on June 15th, just a little more than a month ago, the Pennsylvania Environmental Quality Board met, and one of the items on the agenda was to accept the Drexel report and move ahead with development of a Pennsylvania MCL for 1 or more PFAS compounds. In the introduction of their report, and this is important, this is what the Drexel researchers found and summarized. This is just a little narrative that they put in, which I think is very interesting. They summarized prior studies on occurrence of cancers in humans. Remember those studies that had studied 69,000 people in the Ohio Valley and many other studies across the country where PFAS contamination has occurred. And they noted that there was only a small elevation of risk in 4 types of cancer. And there were also negative associations, meaning that, in some cases, cancer occurrences went down with increasing exposure. So there were inconsistencies across studies, and the Drexel researchers concluded that cancer endpoints for PFAS compounds that rely on animal studies are not supported by the totality of human and animal evidence. And all MCLGs that were developed were based on non-cancer endpoints and were at levels that the Drexel researchers concluded would be protective against any potential carcinogenic effects. So when people talk about PFAS compounds as being carcinogens, some of them may be at high levels, but looking at the non-carcinogenic effects and setting standards based on those effects will protect against carcinogenic effects. This table summarizes the recommendations for MCLGs for 7 PFAS compounds studied by Drexel, and the values range from 6 parts per trillion to 108 parts per trillion. It's important to note that an MCLG is a goal, not a limit. To develop a legally enforceable maximum contaminant limit, a regulatory agency must look at other factors, including technical feasibility of treatment to achieve the limit, cost, affordability, and other factors. MCLs are often set at levels much higher than the MCLG, and typically the federal range for MCLs is 175% to 400% of an MCLG. Just a little bit of behind the scenes, what was in the Drexel report. In arriving at their MCLG recommendations, Drexel used modeling that incorporated several values for each compound, such as the average half-life in the human body, how long the chemical stays in the body, this placental transfer ratio, looking at impacts on fetuses, breast milk transfer ratio, duration of breastfeeding, and relative source contribution, the assumed percentage of exposure to a compound that would come from drinking water as opposed to other sources. They generally used a relative source contribution of 50% for infants and 20% for adults. And the way you pick that number has an impact on what the MCLG is. If you assume that 50% of the exposure is coming from drinking water, then you're assuming that there's another 50% coming from somewhere else, and you basically have to cut the MCLG in half to protect from the unknown part as well as what's known in the drinking water. This is just one table for one of the 7 compounds that they worked on, showing the process that Drexel went through to come up with their MCLG recommendations. And in addition to all those transfer factors that I had talked about and the other factors that went into the calculations, there was something very important called an uncertainty extrapolation or uncertainty factor. In this case, they threw in a factor of 10 for human variability, 3 for taking animal studies and transferring them to humans, and 10 for the difference between a low adverse effect ratio and a no adverse effect ratio. You can't really measure a no adverse effect ratio, but you can measure a low adverse effect ratio. So just divide it by 10 and figure that that's going to be protective. So the total composite uncertainty factor used was 300 for PFOA, which means that their best guess of what a safe number would be, or a low adverse effect number, divided by 300, and that's where you set the MCLG. This is something the general public doesn't understand in the standard setting process, but it is typical of DEP's standard setting process, or an EPA standard setting process. This is a very recent slide courtesy of Dr. Charles Hertz at Essential Utilities, and it shows where Pennsylvania DEP appears to be heading in its long process, still probably a couple of years off, in setting a drinking water MCL for PFOA and PFOS. Notice that for PFOA, Pennsylvania seems to be aiming at about 14 parts per trillion and about 18 parts per trillion for PFOS. The good news is that the suggested MCL for PFOA happens to be the same as the current standard in neighboring New Jersey. So consistency is a little helpful there. The standard for PFOS is higher than the other states, but not by much. So same order of magnitude as other states that are taking on this process of their own standard setting. Meanwhile, in advance of the establishment of a federal or state drinking water standard for PFAS, state, federal, and local and ratepayer money is being spent on studies and treatment. $5 million was added to a federal defense appropriation for funding health effects in Montgomery and health effects studies in Montgomery and Bucks County. Millions are being spent on treatment. Politicians are lining up for photo ops, but some important questions remain. Most water utilities faced with PFAS contamination have been opting to use granular activated carbon or ion exchange filtration, and questions remain about both of these treatment processes, such as disposal of backwash water, regeneration of or disposal of spent carbon, and even coadsorption of radon on carbon, creating radioactive lead-210 in the contact vessel. As drinking water suppliers struggled to respond to reports of PFAS, the American Water Works Association published a 9-page briefing on PFAS. And a sidebar in the pamphlet tells the story of Cape Fear Public Utility Authority in North Carolina that spent about $46 million to address PFAS contamination and filed a lawsuit to recover costs and damages. The CEO of the Water Research Foundation is quoted in the sidebar in this pamphlet as saying, "We're all aware of the extraordinary public concern and also political action. Yet, how do we try to still keep a seat at the table for science in the conversation around PFAS?" Keeping a seat at the table for science in the conversation around PFAS is a challenge. New Jersey DEP has asked wastewater dischargers to monitor effluent for PFAS compounds, even though there is no approved method. David Blye will talk about the challenges of analytical methods next. There's also no proven method for removing trace levels of PFAS compounds from wastewater. The challenges are very different from treating drinking water. Amy Dindal will speak later today about treatment solutions, including some promising developments that might address some of the problems that arise with current treatment technologies. At a joint meeting of the Monitoring Advisory Coordination Committee of DRBC and the Science and Technology Advisory Committee on June 15th of this year, DRBC reported that they were analyzing samples from the April boat run for PFAS compounds and would be collecting samples of ambient water, sediment, and fish in June and September. This may add to our understanding of the spatial and temporal distribution of PFAS contamination and the trends of that contamination, since they have been doing this for a few years now. And Greg Cavallo will speak after our break about trends in PFAS levels, both in human serum as measured by the NHANES study over decades and in the environment.
Preston, that was a lot to cover. And I think let me ask you one question before we move on. The Drexel study, which I saw in the chat, is of interest to people. Is that publicly available?
It is publicly available. I'm trying to think if I can easily find the link to it. It is linked in the documents for the EQB meeting that was held in June report.
So who hired Drexel?
The Department of Environmental Protection.
Okay. That's always a question about these sorts of studies. So thank you for that. And the notion of science seat at the table is one that I think all of us on the call are going to be interested in keeping as a visual for ourselves, because some of this momentum that we've seen, there's no real opportunity to call a timeout. And without an opportunity to call a timeout, science may somehow be compromised or left behind somewhat. So it's a good visual, at least for me, to have science with a seat at the table. David Blye, who will be our next speaker, will kind of weigh in also on the science and the seat at the table and talk about some of the sampling challenges associated with PFAS investigations and characterization, which also play a part in conclusions that can be drawn from various presentations and studies and advocacy. David?
Good afternoon, everybody. I hope over the next 20 minutes, providing I am timely, to perhaps scare you a little bit about how we are way down the road in evaluating PFAS, but currently we don't have approved analytical methods for anything other than drinking water. And so to start out, I thought I would just share what I found to be an amusing photograph. Little news story from Wilmington, Newark, Delaware area. One of my partners, Sean Gilday, is in that picture. And when he showed it to me, I said, that's going to be the first slide in every presentation I have. And I also asked if he was going to contact the local fire department to see if he could begin his retirement. So this is a picture of AFFF foam spread at a park where the children were invited to play in it. I think in 2021, that would be a pretty scary thing based on the media exposure that we have. The other thing that I wanted to emphasize is we're going to spend billions of dollars on PFAS investigation and remediation. And again, I hope to leave you with the thought that perhaps we're focusing some of the money in incorrect areas at the moment. So by way of introduction, part of the reason that we're looking at PFAS is because of its wide use in commercial products. And so it's been used in carpeting. Most people are familiar with the trade name Scotchgard, Gore-Tex. It's been used in paper wrappings. The AFFF for fighting fires is a huge use of the material. And so it's in a lot of commercial products, and hence has the potential for a lot of exposure and entry into the environment. I found this flow diagram interesting about kind of setting the stage for how easily we distributed PFAS in the environment. And so, you know, if you look at it, products end up in wastewater treatment plants. They discharge to the rivers, rivers discharge to oceans, they expose aquatic critters, sludge ends up being disposed, and we have landfills. And so there are many, many avenues for the distribution of this class of contaminants. And so, you know, one of the big issues that we see right now is there is a lot of sampling going on and data collection for all types of media, but EPA has been very slow to develop validated analytical methods for anything other than drinking water. And so why is that a problem? Well, as you will come to see, there is differences in procedures that can lead to poor data comparability. If an industrial party is collecting data and a regulator is collecting data, and they use two different labs using two different analytical approaches, you know, what time is it if you've got two watches on? There's a lack of general accreditation by states. Because the analytical technique is relatively new to environmental testing labs, most analysts have maybe 2 or 3 years of experience with this instrumentation and class of compounds. So we're making a lot of decisions, as you will come to see, with modified methods, and what does that mean? And more importantly, as Preston just explained, we've got a lot of interpretation of data with very few toxicity benchmarks for the majority of the compounds that we're looking for. So huge national media attention. It appears that no industry will be immune. Everybody will have their chance to sit at the table. We don't have methods currently available from EPA that allow us to make the decisions that we need to make. Laboratories are being requested to analyze for PFAS in just about everything without approved methods. And so most labs have developed their own procedures, and those are modifications to the drinking water method. And that has led to some amount of chaos in terms of data comparability and the ability to directly compare numbers across different labs and different projects. So certainly planning and communication in these types of projects is critical in engaging the right type of expertise. So if we look at here today now, the methods that we have available, there are 2 drinking water methods. One is 537, and that uses a solid phase extraction technique where surrogates and internal standards are used. More recently, EPA developed method 533, which also is a drinking water only method, uses solid phase extraction with what is referred to as isotope dilution. And that technique is considered a gold standard in analytical or environmental analytical techniques. And the important thing is drinking water methods are extremely prescriptive. They tell you precisely and accurately what to do with very little chance for modifications. More recently in 2019, EPA issued draft method 8327. That method was put out for public comment. Environmental Standards commented on it on the behalf of a bunch of stakeholders, and quite frankly, it was a failure. There are a handful of other methods, other test method 45 for stack emissions. ASTM has some methods, but those are not widely used in our regulatory environment. And so what we're faced with is most labs developing approaches based on method 537 and using the moniker method 537 modified. It generally means you don't know what they're doing unless you see their lab SOP. So lack of interlab comparability comes from these internally developed methods. Part of the point to EPA developing methods is that they undergo individual and multi-lab validation, and that you have a chance of getting the same answer by using a different laboratory, and you should not presume that with the current PFAS methods other than drinking water. One of the issues that I'll dive into a little bit as we advance in the presentation here is that currently most labs are really reporting total PFOS and total PFOA by combining branched and linear isomers in the manner that they report those two constituents. So we have lots of states embarking on legislating MCLs, but no uniform method to ensure compliance. It sure seems like we're putting the cart before the horse. We have a standard, but no way to ensure that you can consistently measure against that standard. Lastly, EPA is embarking upon a 1600 series method, which is an isotope dilution method. They've been working on this for a couple of years, quite closely with the Department of Defense. And, you know, rumors are that it has problems. And so that doesn't leave me with a very good taste in my mouth. And so I just simply say, what is EPA waiting for? We're years down the road, and you sure would think that there would be an emphasis on creating a method that we, even if not perfect, even if it has some flaws, at least we would all know what they are and could consistently evaluate them across the lab universe. Today, we're stuck with literally trying to understand what each and every lab is doing and their approach to the analysis. And so what are we looking at PFAS in? Pretty much anything. The raw products, surface waters, sediments, dust, food, beverages, milk, biological fluids. And we have, again, no consistent methods to look at these various matrices. So if one breaks down the impact from the lack of data comparability, each one of these steps in an analytical method, the way you calibrate, the way you monitor performance, most importantly, the way you extract the sample. So fathom that the only EPA approved methods are for drinking water, and we're extracting solid samples or sediment and soil, which by the way is not water. The drinking water method mentions not one word about those type of matrices. So when a lab says they're doing 537 modified, what's that mean relative to a soil or a solid? You really don't understand how they're extracting until you do a deep dive into their particular approach. And as well as the way that analysis is being performed at the instrument, and the reporting of the compounds. So I have a slide on each one of those topics, but we certainly don't have time today. And so I'm simply going to tell you that we see variability in the way the samples are extracted, calibrated, which calibration techniques are used, variance in the quantitative criteria to monitor the analysis. And in the end, not only do we have these analytical issues, but in the analysis, we have lists that range from 6 to 14 to 24 to 28 to upwards of 75 compounds, depending on what the lab and a given state has dictated. And so when you factor in that lab A might have analyzed the sample for constituent A with 12 compounds, and lab B, did an entirely different longer list, that issue alone presents quite a bit of chaos. That draft method 8327 that EPA attempted, again, the draft method had a validation study that was brought along with it. And in many aspects of that method, there was just a lack of demonstration that the method worked. And so we commented, you can ultimately get a copy of my slides and go and look at our comments to the method, which were extensive. But it had lack of definitive performance metrics, lack of resolution criteria in the methods, and a number of other items that just, again, led to a method that was really not useful to the monitoring community. So one thing that I would like to emphasize to show you how there are issues that need to be addressed in the current methods is this issue of isomers for PFOA and PFOS. If you remember back to your general chemistry days, an isomer is a common molecular formula, but the way that the atoms are positioned are different from isomer to isomer. And so to set the stage for the last part of the discussion here, there were two main mechanisms to produce, in particular, PFOS. One was electrochemical fluorination, and that provided a mix of branched and linear isomers of PFOS. That was primarily used by 3M. And then the second process was telomerization, and their intent was to get an isomerically pure, preferably the linear compound. but it did have some impurities of different chain lengths. And this was primarily used for DuPont. So in the environment, we have not only the linear PFOA, but these branched isomers of PFOA and PFOS. The slide that we're looking at here was a researcher's work to try to identify some of the possible 89 isomeric structures for PFOS. In the calibration standards that we see, there are about 11 of those isomers. And so if you look at two types, a technical grade and then a quantitation grade, which would be used for analytical work, they have about 68% linear, 30% methyl isomers, and 2% or less of the dimethyl isomers. So analytically, if you look at the top right-hand panel, which is PFOS, the linear peak is that large peak at roughly 687. And then our two smaller peaks are the methyl and dimethyl isomers. The technical grade standard can't be used for quantitation. So we have quantitation grade standards, which mimics but doesn't exactly replicate the technical grade mixtures that were out there. And even more importantly, right above the bottom panel at 4.6, you can barely see the dimethyl peak. And so there are differences even in the way the standards appear to the instrument. So why is this important? You heard me mention earlier that what most labs are reporting are total PFOA and total PFOS. So what's that mean? If we look at our upper left-hand panel here that says calibration standard, that is in fact the chromatographic peak for PFOA in a calibration standard. And now if you look at the bottom right chromatogram, we are using isotope dilution for this analysis, and that provides us a chromatographic marker in each sample. And so this is the chromatogram for the C18 PFOA, or the labeled PFOA. And now if you look at the bottom left panel, that is PFOA in a sample. And the arrow is pointing to the linear peak. And the next two peaks are the methyl and dimethyl branched isomers. In the case of PFOA, we don't have a calibration standard that is quantitative for the methyl and dimethyl isomers. And so EPA told labs as part of the drinking water method that they should integrate any of the peaks that they have verified to be isomers and quantitate it against the linear calibration standard. So what's that mean? That means right off the bat for PFOA, if you have any branched isomers in your sample, you are doing, in fact, an apples to oranges quantitation, which means right off the bat, your concentration being reported is an estimated value. And to me, that's important. Why? Because we have numbers, standards, MCLs, drinking water or sediment remediation goals, you name it. And we're being asked to compare our results to those various levels. And I don't think it's even widely understood that what you're really doing is looking at total PFOA with some lack of definition of, is that standard that they're quoting total, linear, isomers, branched isomers included? It's pretty difficult to figure that out, I can tell you. So I'm going to buzz through a couple of more examples, which we can do quickly, but this is another example where, currently we have 4 PFAS compounds where we have linear and branched calibration standards, but we see evidence of branched components or branched isomers for other PFAS compounds. And it makes a difference in the way the lab has elected to include or not include those. In this case, the top 2 panels are for the hepta acid and the nonoic acid by lab A, same samples, lab B underneath. The client came to us and went, why are we getting twofold differences for the results in these samples? And the answer is, in the top, the lab A had poor resolution, and they elected to integrate 2 peaks as one and report it as hepta and or the nona acids. Whereas the laboratory in the bottom looked at that little valley. You can see it in the top panel too, for the hepta acid, not so well for the nona. But the lab decided, hey, I don't have a standard for the branched and linear components. I only have linear. So they integrated the linear peak, and that's all they reported. Well, you can see in the bottom right panel for the lab B's nonoic acid, the isomer, the branched isomer was significantly more intense than what got reported for the PFNA in lab A. And that was the reason that there was differences. But if you're not attuned to how to understand this data, and there is no guidance to the labs on how to approach it, then you can very easily get difference in numbers just by the way the lab has elected to report the values. And to demonstrate kind of the range of possibilities that we see in data, if you start at the upper left panel, this is PFOS at one site, and as you move across the right, the changes in the variability in the branched and linear components is quite drastic in all these samples, to the branched isomers being the most significant, like in the bottom left and right, to it essentially has disappeared where my red arrow is pointing. We have no more linear PFOS in these samples. And one of the comments that we made in draft method 8327 is, if the labs can integrate these peaks separately, why not report them separately so that we have that value and that information before us as part of the test. And this is just PFOA showing the same thing. One site, variability in the branched and linear components, yet in PFOA, we don't have a quantitative branched and linear standard. And so all of these would be reported in my apples to oranges scenario, where the linear calibration standard is used. And we know as chemists that the response is different between all of those isomers. So in conclusion, just keep in mind that we only have approved drinking water methods, and we do not have US EPA validated test methods for anything other than drinking water. And so, laboratories are literally creating and inventing their methods, and those method modifications can take many forms based on the way the lab has elected to do the test. Comparability between labs is complicated as a result of the difference in approaches. These extraction and analytical techniques impact sensitivity and qualitative information, as I demonstrated. How labs may elect to integrate PFAS compounds that have branched and linear components can vary. And so again, that planning and communication part with your lab is critical. So you should be critically reviewing sampling procedures and analytical requirements. Work with labs that have demonstrated longevity and experience with the LCMS techniques being used. Audit labs, audit field teams. We certainly recommend data be validated so that you understand some of the discrepancies that may exist in your data. And we also are advocates of troubleshooting and correcting data when we see it being incorrect, and making use of centralized data management systems to help you look at these massive quantities of data. So thanks for bearing with me. I know some of it's technical, but if you leave with anything, it should be that it's a bit of the wild, wild west out there until we get some more uniform methods. Thank you.
Thanks, David. I think what you underscore, in the ordinary course, it's hard enough to collect a sample, analyze it, compare it to a standard, and know whether you're meeting the standard or not. At any stage, that process falls apart quickly if you don't have a reliable way to determine whether you're meeting a number, but more equally important, you don't have a reliable way to set a standard.
Yeah.
Because there really is no way to be assured that a number on a page, some of you have heard me talk about it that way, the number on a page is accurate and reliable or not. And I think the level of detail you went into on these compounds illustrates that in such a politically charged environment that makes all the more pressure on all of us to make sure we're doing the best we can. So thank you. So we're going to turn now to Greg Cavallo. Greg has spent a large part of his career in this region, and he's done a very thorough evaluation of certain data sets relating to this class of compounds, and has an analysis of what the data shows that he would like to share with us. Greg?
Thank you, Mark. I really appreciate it. I'm going to share a screen over here with a presentation of a lot of the data that's been collected in the Delaware River Basin. We're very fortunate here to have a significant body of evidence in this basin. Both water and fish tissue have been historically collected primarily by the Delaware River Basin Commission. For the water, it's been 14 years, and I think for the fish tissue, it's been almost 17 years worth of data. So what I'd like to talk to you about are the trends in those data sets. And these are water samples primarily from the Delaware River, the tidal portion, from Trenton down basically to the ocean. More recently, PWD, Philadelphia Water Department, has also collected water samples at one location in the main stem. And as Preston alluded to earlier, the commission has currently enacted a long-term monitoring program for PFAS as part of their boat run. And this will be done on an annual basis, if I understand it correctly. Concurrently, there's a separate funding source for fish tissue, water, and sediment. They might be able to look at bioaccumulation. They do have a long-term fish tissue concentration data set, like I said, from 2004. Basically, 8 sampling events were conducted from that period. And there is, and those are the 2 in the basin, there are blood serum samples, as Preston shared, and that I will extend from the NHAMES, the National Health and Nutritional Examination Survey, that's really very telling. So we do have, in this talk is going to focus on PFOA and PFOS. So as Preston mentioned, it's been in production for a long time. The National Institute of Health has said, hey, there's 4,700 compounds. And this is the family tree, so to speak. On the right, you have basically non-polymers and polymers. The polymers are really long-chained fluorinated compounds like PTFE, the polytetrafluorinated ethylene. Um, those are thousands of compounds or thousands of carbon molecules long and associated fluorinated uh, positions. EPA doesn't consider them to be particularly hazardous. A lot of this data was taken from the Interstate Technology and Regulatory Council, an excellent website for primers on PFAS, everything PFAS, toxicity, naming conventions, treatment technologies, the latest on what the states are doing. It's really kind of nice. So polymers aren't an issue. The polyfluorinated are not completely fluorinated. We're going to focus on the perfluorinated, the carboxylic acids and the sulfonic acids. Those are just 2 out of thousands of compounds. And those are basically the PFOA and the PFOS. Now, you saw earlier, they have a head. I don't know if you heard the nomenclature, a head and a tail. The head is where the carboxylate or the sulfonate is. And basically, the head is hydrophilic, which means it has an affinity to water. The way I remember this is that if you picture a duck feeding in a pond, the head is in the water and the tail is out. And it's kind of very helpful. Of these 2 compounds, the PFOS is the most bioaccumulative when compared to the PFOA. So in that case, you'll see in the next slide that the different states have put together different drinking water and groundwater standards. Now, US EPA has a health advisory of 70 parts per trillion, PFOA and PFOS, either individually or combined. Delaware and Pennsylvania follow suit. And as Preston alluded to, New Jersey's taken a different tack. And I'm going to explore some of the basis for that. They're using 14 parts per trillion and 13 for PFOA and PFOS, respectively. Excuse me. So let's start with the data sources I evaluated. Philadelphia Water Department collected on the Tidal River at its intake. This is for one of the 3 intakes for the city of Philadelphia. This is the raw water source on the Delaware River, and they collected 12 samples from 2019 through 20. The DRBC had a periodic monitoring program at more locations, which was done earlier from 2007 and concluded in 2015. The most expansive, the most, I guess, representative data set is the fish tissue, because the DRBC collected at 5 locations and they use 5 fish composites. So it's not just one fish that they sample once a year. These are 5 fish composites using EPA protocols for standard fillets, and they started it in 2004. And we were fortunate that about the same time, the National Health and Nutrition Examination Survey, the NHANES study, had included both PFOA and PFOS, including a few others, in their study program beginning in 2000. So we're kind of moving up the food chain here. We're starting with water, we're going to fish, which bioaccumulate, and the ultimate receptor, humans. And we want to see this. So let's look at the data, because that's what I'm here for, and that's the interesting part to me. This is the PWD sample that they collected. That's their water intake. That little spigot is their water intake. This is the city of Philadelphia. This is Camden. This is basically fresh water in here. There is occasional incursions of slight salinity, but this is the water intake. On the other side of the river is American Water's intake. So this is a very important location to understand what's going on in the tidal river. This data, and I have to give it the accreditation, was taken from a report or presentation given by PWD staff at DRBC's Toxic Advisory Committee meeting. This was 2021, January 2020. These are the mean values for PFOA and PFOS. That's the mean. the average is 4 and about 4. These are the medians, which are a little lower, which tells you the higher values are kind of knocking it down a little bit. Both of these values are well below the 70 from EPA's health advisory level, combined or total, individual or total. And they're basically half, 1/3 of what New Jersey's is for each of these compounds. Let's go see what the DRBC's data looks like in the river. As I said, the intake for City of Philadelphia is up here. These are the sampling sites DRBC had in 2015. They did a very complete survey. Unfortunately, in 2007, it's the blue boxes. They took them in 2007-8. They took them occasionally just to get a feel for it. It was early on. People didn't know. So what I'd like to do is I'd like to start at the bottom of the basin here. Basically, this is, listen point, Wilmington's up here. The C&D Canal is here. And basically, this is becoming the mouth of the bay. So what does the data look like at the lowest point? River mile 50. I'll go back right here. This is just above River Mile. Okay, so here we go. Wilmington's here. Delaware City's here. The C&D Canal is here. PFOA concentrations. Now we're looking at 2007, 8, and 15. These are parts per trillion. You started in the 50s and you go down. These two are similar, but then again, remember, they're only collected a year apart into the single digits. PFOS is a little bit different, and this is what the data shows. It never was that high. It was always in the single digits. So granted, this is not a drinking water source, but if you look at the criteria, anything set by the states in the basin, this is well below. This is well below. Granted, it's only one data point at each year, but it shows something. Let's take a trip upstream to the Pennsylvania-Delaware border. Now, this area here between Philadelphia and Wilmington is historically highly contaminated. We know this from some of the PCB work and other contaminants of concern. So what does this look like at River Mile 80? Still not a drinking water source, but for the same two contaminants. PFOA, again, 76% reduction. What's interesting is this concentration here is about half of what it was downstream. It still goes into single digits. PFOS, I may have taken some liberties with this, but essentially single digits over here. And from the highest concentration, about a 50% reduction. It's interesting. Now we're going to move further upstream. We're going to move to the drinking water intake for the city of Philadelphia and for American Water. The reason I have two red dots is in 2007 and 8, they collected at River Mile 105. And in 2015, they collected at River Mile 111.5, right? And there's their drinking water. So we're going to bracket this. PFOA is an order of magnitude less than it was down in the bay. It was 50 down at River Mile 50. It's 5 up here. It's gone down, but this is really low numbers. Again, well below the 70 parts per trillion, EPA's health advisory level, and New Jersey DEP's levels. Same thing here, PFOS concentrations. So we have a general sense that as you move up the estuary, the concentrations were higher down there originally, but they've come down to about the same point from 2007 to 2015. Granted, one sample, one survey per year. But let's take a look at fish, because fish are an excellent integrator of what's in their environment. They bioaccumulate. And the beauty of that is it's used along with drinking water intake to calculate a water quality criteria if they were to do that. So fish and water are used. As I said, the DRBC collects fish tissue at 5 locations. It collects 2 species at each location, white perch and channel cat. White perch is considered pelagic, which is in the middle of the water column, and channel cat is benthic, bottom feeder. You may get an argument from some biologists, but that was the intent. And they collected these over the years. They collected from 2004 to 7, 10, 12, 15, 18. I believe they're doing it again in 2021. And you're not just collecting one fish, you're taking 5 fish. There's an advantage to that. You're integrating some of the variability in the fact that you're filleting 5 fish and you're basically homogenizing it and running the extract. So let's take a look at River Mile 80 because that's where we had some water information as well. And let's look at PFOAs and PFOS in white perch, River Mile 80. Let's start with PFOA. There is no PFOA in white perch. That was measured. I should say there is no measured PFOA in white perch for the entire period of record that these were analyzed. I can see Mr. Blye thinking, well, wait a minute, this is a detection limit thing. This could be something going on. I can imagine 5 questions. So what I did is I looked at the detection limits for these samples, and we're in the parts per billion range here, and they're pretty consistent at 2.5 parts per billion, and we get into the parts per trillion here. There's just no detectable concentrations of PFOA in white perch. They don't tell you this sometimes. You got to look at the data. So here, let's go take a look at PFOS in white perch. A little different story. This is River Mile 80. Remember, we were seeing the water about 5. So it has come down. The water concentrations come down. It's kind of consistent with the fish tissue. I could have done an ANOVA, but I just wanted to show the raw data. So the 2018 is actually the lowest concentration of PFOS in white perch at that River Mile. And who knows what we'll see in 2021. So now let's take a look at the channel catfish. Same thing. All the catfish show non-detect for PFOA. From 2004 to all the way to 2018. Again, the detection limits were about the same as they were for the perch. So I don't want to show that. The channel cat for PFOS have detectable concentrations. And this is, I guess, the point I was trying to make earlier. When you got these red bars, that's the detection limit in parts per billion. So when you see this and it's elevated and you see one where, you know, the concentration is above that, you're uncertain as to where the concentration may lie in this range. But in general, if you're assuming this trend through here, 4 to 5 parts per billion, and then you look at the 15 and 18 data, which have better detection limits, you clearly see a declining trend in these samples. Let's summarize it for all the fish in the tidal Delaware estuary. So these are everything. These are basically all the samples collected at the 5 locations from the C&D to near Trenton. And I'm only showing you PFOS because there were no detectable concentrations of PFOA in any of the fish sampled. And when I look at the data, and I had to look at the 2004 through 2007, see where there were some detected concentrations. There was, you know, for channel cat, some of them didn't have it. So I used the data that I had, and there is a relative decline from this time period until 2018 at all locations for all species of fish for PFOS, except for channel cat, where it was completely non-detected. This is the C&D Canal, or a little bit below that. This is the Pennsylvania-Delaware border. This is just below the Schuylkill River. This is up where City of Philadelphia gets their water. And this is the Crosswicks Creek, for those of you familiar with the basin. So there's been a general decline in all of these. I'm not presenting the other compounds that were looked at in fish. PFNA and PFUNA show similar trends. That data is available online at in a DRBC presentation. So let's take a look at the ultimate receptor, human population. I took this data from the I didn't take the NHAMES data. New Jersey DEP, in developing its PFOA and PFAS criteria, cited this in its 500-page appendix. And if you look through it and you say, well, wait a minute, this is pretty good. Looking at geometric means, and you also get the 50th and all the way to 95th percentile, and you're talking about thousands of samples. These are samples collected across the population of the United States. There are the cohorts, the population sampled, varied based on sex, age, and race. And so this is a pretty good cross section. And given that the Northeast is in the United States in a pretty big percentage, you can't break it out for just this area, but you can look at a general trend from 2000 to 2012. It's gone down. It's gone down substantially. So what I have done is I went on to NHANE's site, downloaded the last available year of data, which was 2017 and 18, and I just plotted it. So PFOA was always a little less. It was always a little less in non-detect in the fish and higher in the water, which is interesting because it doesn't bioaccumulate as much, which kind of certifies that idea. But we also see it's decreasing in human blood serum on the order of 76%. And Preston alluded to earlier the reduction in manufacturing, the elimination in manufacturing. And it was a stewardship program that was started in about 2006. And 6 or 8 companies that came in and then just said, hey, we're getting rid of this. Perhaps there's some relationship there. I don't know. Let's look at the PFOS data. This is, again, a chart that New Jersey DEP put into their document in support of PFOS, water quality, drinking water standards. And you can see, again, this is a pretty nice decline. Well, what happens if we extend that to 2018? We actually end up in the same place, but this is a 96% reduction. The beauty of this is the half-life of PFOA and PFOS in humans, and this is from literature values, ranges from 2 to almost 4 years for PFOA, and a little bit longer, 3 to maybe 5 years for PFOS. So it's kind of interesting that this is following a really pretty steep decline rate. I think I calculated the half-life at 6 years or so. But really, when it comes right down to it, it's going down in the water, it's going down in the fish, and it's going down in human blood serum. And a lot of that, I think, the credit has to be given to EPA working with industry. And industry has to take some of the credit and say, hey, we listened. We basically took it out of production, took it out of our products, and don't import it. That initiative has reduced the longer chain hydrocarbons. Current water levels in the urbanized portion, the Philadelphia, Wilmington portion, are 10 times less than the EPA's health advisory. That's for raw water. And it's still about half to a third of New Jersey's MCL, trending lower. Fish tissue, non-detect for PFOA across all fish species everywhere in the tidal river from 2004 to 2018, and trending lower for PFOS. Human tissue shows similar declines, probably most significant in the PFOS. So the data may tell a different story. I think one of the questions somebody asked is, what's all the hype about? Well, there is toxicity information on these compounds, and since they have that, they I think started to expand on that. And I'm just speaking about the tidal portion of the river. I'm not talking about tributaries, and I'm not talking about groundwater in states that have, significant sources nearby. I'm talking about the tidal Delaware estuary. These are the results, and we will have additional information as DRBC and others collect more data for fish, water, and sediment. Okay.
Greg, that was excellent. And I'm guessing that if we had put up a question, what do you think the conditions of the Delaware estuary are? My guess is people wouldn't have reached this same conclusion. But what I wanted to get to now, the reality is this is an issue that needs to be addressed. There's a lot of pressure on industry and public water supply systems to deal with this, even though there's a lot of uncertainty on a lot of aspects of it. And Amy's going to give us an update on where we are from a technological standpoint in terms of remediation and treatment.
Yeah,
Amy?
Thank you, Mark. I appreciate that. And I particularly appreciated your comments about batting cleanup and connecting that with the presentation. So
How about that?
yeah, that was pretty clever. So good job there. And I also think that, you know, this presentation really does culminate a lot of the different themes and comments that we heard from the previous speakers, really talking about the totality of the challenges and kind of where this is all going. So I am Amy Dindal. As you heard, this was quite some time ago now. I'll just remind you that I'm our PFAS program manager and went to Penn State. I saw that, Mark, with the yes. So yeah, so definitely focused here to talk to you about those technology solutions and where the industry is going. As Mark just said, you know, we're not here to debate the levels of concern or whether or not there is a problem, but rather if there is technology needs, there is a number of things that industry is responding with new technology and new ideas in order to address them. So what we might start with, again, I think is a good collection of what we heard over the last hour and a half of what is really the challenges with these compounds. Why are they so difficult? So one thing we've heard repeatedly, and I think you're all aware if you're sitting in on this panel, is there's a lot of compounds. There's, you know, several thousand in the class. We've seen those numbers. Preston started us off with that 4,700 and something number, but you know, there's really just hundreds that have been in commerce, and there is little known about the totality of the class. But the differences there are amongst the class is one of the things that makes it challenging. The persistence of that CF bond, right? We've heard about that, and the fact that they are bioaccumulative. Greg just gave a great presentation on the blood serum levels and the decline that has been seen in those samples that he had talked about. But there is a bioaccumulative effect because that CF bond does not break on its own. It requires some action in order to break that bond. And that's because of the many uses of these compounds, and that's what's shown them to be useful. So, but it does add to the challenges. Another thing is the mobility of the compounds. Some more than others can transport through the environment, and so that is another challenge that really makes them more difficult to treat. We heard about the sources, the many different types of things that have PFAS in them or sources of PFAS. And so that is another challenge here because it can come in many different ways, many different forms. And so I forget which one said, you know, I think it might have been David that said, you know, no industry is safe or something to that effect. But you know, it's all across our environment in different sources. And so when it has those different sources, it makes it a challenge. And another interesting thing is co-contaminants. You know, when you go on some of these environmental sites, they'd be focused on one particular contaminant of concern, and then on the scene comes PFAS. And sometimes PFAS is a little, or sometimes it's a lot of that equation. But the fact that there are other contaminants to treat often, and then you have the persistence of the CF bond to treat along with it, it makes an interesting challenge, especially when you're talking about these low part per trillion levels, which we've heard about quite a bit today. And then this last one, I don't need to spend any time on. David covered it well, but there is, you know, this, there, give me the fist bump there. But yeah, I made sure to summarize there that there are these lack of analytical standards, which does add to the complexity. So what can be done, right? So we heard a lot about those standard methods that are out there. But when there is, you know, other things that are emerging that are here to help us to understand the issue, I think that's what we want to be aware of, that there are things that are emerging. And in particular, when you're talking about segregating these sources, how do you go about doing that? You know, the most informed and the most efficient actions can be taken when it's based on good science and based on the most information. So what has been coming on the scene, in addition to those methods that David talked quite a bit about, those standard methods and other methods that are emerging, is something that is known as total PFAS methods. So when you often are looking at these target PFAS compounds, whether it be 6 or 12 or 24, as David said, there's a number of different methods or compound lists that are associated with these methods. You're typically only looking at a certain swath of PFAS compounds when you're only looking at those targeted methods. And often if you look at something like an AFFF sample, if you look at just the target non-targeted method, you're looking at just a small fraction of the total PFAS. So there is this black area of black matter, they call it, when it comes to PFAS compounds. And so there are total PFAS methods coming on the scene, things like total organofluorine methods that'll measure the total amount of fluorine in a sample, for example. That is one level of information. And again, these are these emerging technologies that are here to help us to get more information. But what about technologies that are able to differentiate between things like those sources of AFFF and non-AFFF? What are those kinds of things looking like, and are those things possible? Well, in fact, that is where the science is going. Again, in the interest of gaining more information and having a better understanding. You know, not a simple task, as David said. Even the basic target and list of analytes are challenging in and of themselves, but to be able to provide that differentiation and to be able to also distinguish between those sources, that's where the science is going. And that science is going through the use of these forensics and source tracking methods. And those things are pretty complex, and they do require a level of sophistication beyond the basic analytical method, but to also understand the PFAS chemistry itself and to be able to interpret it. There was a recent publication that came out in Environmental Science and Technology that really spoke to this. This is from some of the leading academic analytical experts in PFAS chemistry, talking about the challenges of forensic source tracking and what are those technologies that are there and what kind of approaches should we be taking in order to have an understanding. And these are just some of the key points from this article. I think it was a pretty good reference, and it just was published here in June, but talking about looking at a conceptual site model at a site. And when you're looking at that, ensuring that the approaches that are being taken are based on things that go beyond that targeted method, things that utilize high resolution mass spectrometry or non-targeted methods that really enable, you know, a broader understanding. And so again, it's that multiple line of evidence approach and being able to understand it from a number of different angles. So when we talk about PFAS, and we've talked a lot about advances in analytical or things that may be coming from this presentation and the others, but what else is out there in terms of sampling technologies? Greg's presentation was focused on the Delaware River Basin and sampling of rivers and what have you. One of those technologies that's coming on the scene is these PFAS passive samplers. So one of the interesting things about this, and I kind of talked about this with the challenges, is you can't just pick up these technologies that we use for other contaminants and automatically use them for PFAS. And the area of passive sampling is one of those. So the advantages of using a passive sampler, it is one where you can, for example, an equilibrium-based sampler where you place it in a water body and then you come back after some period of time and you retrieve it, and you're able to then get some time integrated results. You're able to look at those measurements over a period of time. It allows for some concentration if necessary, especially when you're talking about those lower concentrations. It's not having any disturbance in the water column. You're not generating more waste, and you have a lower risk for cross-contamination. So there's some of these new tools coming on the scene that are there to make these measurements. It does it without disturbance, as I said, passively. It'll sit in the environment, and it's also not deriving investigation-derived waste, which is one of our current challenges when doing these site investigations, because as we do these investigations, we're generating more PFAS waste, and then there's there's some concerns about how those wastes are being disposed of. So this is an advantage to a tool like this, to be able to measure with technology that you can just displace in the ground and then go back and pick it up without generating additional waste. Talked about the cleanup and the treatment and remediation. This is a little bit of an old survey, but it just gives you a sense, even a couple of years ago, as PFAS were becoming more of a contaminant of concern and addressing at sites, what was the demand versus other contaminants? Just to kind of give you a scale estimate, in this one particular reference, it estimated that there are 42,000 PFAS sites across the United States with an estimated cost of $80 billion to remediate. so you know, with data coming out like this, and this again was a couple of years ago, there has been a lot of attention to addressing that challenge as it's been presented. But why has it been so difficult? Again, you can't really just pick up something that's been used for other things and use it. What are the challenges that are associated with it? Already talked about that CF bond, one of those strongest bonds in nature, making it difficult to break that bond and therefore start to remediate those PFAS compounds. The solutions that are out there potentially are going to be energy intensive, and then that may be costly potentially, and it may not be able to be used for all matrices. That's another thing, because of the diversity of things where the PFAS compounds are being detected. This may be difficult to have one technology that might work for all those different matrices. Another challenge you hear about with any technology, when you start to address one problem, are you creating another one? So that's something that is of utmost importance. We want to make sure that when we're solving the PFAS challenge, we're not creating another one. We have another byproduct that's of concern. So something that's always at the forefront of mind, whether you're talking about any technology, but PFAS in particular. Large plume sizes, when we were talking about sites and the dispersion and the mobility of these compounds, you could potentially have it over many miles when you have sites that have utilized it in certain applications such as AFFF. So it may be covering a large area. So that can make it challenging. I mentioned this one before, the presence of co-contaminants. Do you have a little PFAS with a lot of other things? Do you have a lot of PFAS and a little other things? That can depend greatly on the matrix. But again, when we're talking about these very low levels of detection and concerns for those cleanup levels, that causes a challenge when you're talking about dealing with these kinds of materials. And again, I kind of touched on this before, but there's a large number of different matrices, whether you're talking about water or soil or sediment or foam material, as we heard before. There's lots of different opportunities and challenges when it comes to the actual package, sludge, biosolids. There's a number of different applications in matrices. So whether one technology can address it all, definitely needs to be mindful of that matrix as we look at different remediation technologies. So that all seems like a challenge just in and of itself to tick off all of those different things. The good news is there are a number of technologies that are emerging. Going back a couple of slides ago to that remediation survey that was done by the Environmental Business Journal, when you see 42,000 sites and $80 billion, that spurs innovation, right? Challenges spur innovation. And so that is definitely what we have seen. When you're talking about the drinking water industry, I think it was way back in Preston's presentation, he talked about absorption technologies that are typically being used, whether it's granulated activated carbon or ion exchange. Those are ones that were kind of the early technologies that were utilized to address these PFAS compounds. Again, utilizing things that we already had in place and wanting to adapt them for PFAS as best as possible. But as things have transpired, not sustainable solutions necessarily for the long term, because of the number of PFAS compounds that are retained in long term, the need to regenerate and have these cartridges then disposed of. Most recent guidance that has been out there from EPA back in the beginning of the year, there was some draft guidance that talked about different disposal methods. So that's something that really needs to be considered, is what are the end products of these remediation or treatment technologies, because the ultimate goal is really to have a complete destruction or near destruction of all PFAS compounds. So anything that has a byproduct that still contains PFAS in some way, whether it treats it and moves it from one matrix to the other, that's something that we're awaiting some additional guidance from EPA in terms of what that next step is. But right now, the options are to hold on to those until there's a destruction technology that is there, or some other, options like the thermal treatment option of incineration. But as things have evolved, it's getting more and more challenging for those materials to be disposed of by incineration. So again, that is spurring that innovation, and that is spurring the focus on what are our other solutions that might be out there. There's things like a smoldering technology, which does involve heat. There's some, things that involve that higher temperature, but then there's some concerns or there's questions about, is complete destruction achieving? And that's a difficult thing that kind of circles us way back to the original question of analytics and analytical technologies that are there. And the ability to understand and measure those compounds are really important in understanding the effectiveness of these treatment technologies and or destruction technologies. So it is important to have this holistic view because, as I said, there are a number of these technologies that are coming on the scene, utilizing a number of different applications, but each of which has those questions that go back to those challenges for PFAS compounds that are being looked at as these things are moving along. So this has been referenced several times, and I bring it back up because I think, again, we all kind of touched on it, is where can you go for more information? Where are these kind of centralized sources where you have the ability to get information quickly? And it is, you know, very, I guess, go back to some of the statement about science at the seat of the table, right, Preston? I think you're talking about that. You know, we really have these industry groups, this one with ITRC, I think, again, we each probably touched on it. I think it's a great reference when you want to look for more information. Another really good reference is the DoD's CERTA BSTCP program. You can see over the course of the last several years the funding that DoD has put into studying different technologies. I touched on several of these today just to give you an idea of the innovations and the emergent technologies that are out there and that are coming on the scene. But I think this is another very useful reference, and it does give us, you know, that hope as things move forward. There are technologies that are there that are being prepared to address the challenges of whatever they may be. So just to summarize, we are really, I guess what we'd say, this has been going on for, you know, you showed the years in several of the graphs that we saw today, but this really has been going on for quite a while, but yet we're still on the front end of this journey, it feels, with all of the questions that are there, but it could be a long journey. So industry is responding to the needs for those innovations of future needs and bringing those technologies to bear. And these, again, I'll just reiterate, and really my final point and really where I started, where I'll end, is that it does require new thinking. These are new compounds. These are compounds that have new characteristics and one that requires to be new thinking, have new thinking and around new technology.
Thank you, Amy. That was, I know it was a quick rundown of kind of where we are and where we might be headed. It's sort of odd to think about coming up with a solution to a problem that's ill-defined.
Right.
And it keeps everybody on their toes when they're trying to evaluate this. One of the lessons I think learned from the presentations, which I really appreciate all of them, they were excellent, is the fact that we have so much uncertainty up front, yet we have so much public pressure also pushing at us from the opposite direction, with the political aspects of that public pressure response. I think all of it is understandable. And going back to one of Preston's comments, which I think we all liked a lot, science at the seat of as a seat at the table, it's really a challenge, I think, to occupy that seat or to find an opportunity to sit at that table with people who are open-minded and taking a fair look at what the data might suggest. We could have had a panelist on this in this session coming from the other direction, and maybe next time we will, so that we can sort of understand what the motivations are. We have a few minutes left. I don't know, Skelly, if there were questions in the chat, but if they are not.
Yeah, we do have a question
Okay.
for David Blye. What would David have to say about the comparability of data over time, space, and laboratory method for these samples? So if somebody who asked that question wants to raise your hand and provide a little more background.
I think Paul was pointing towards Greg's data, where you know where the decrease is, and so I suspect you're going, is the decrease because of some analytical anomaly? I do happen to know that DRBC tends to use a single laboratory in most of their studies, and so you know, relative, even if one assumed that there was some error because of the technique they used, I think it still allows the data trend to indicate what it does. had multiple labs been used, I might have said, I'm not sure, but
No, that's correct, David. They kept the same lab, the same number of compounds, the same name, labeled analogs, and for all those years that I had presented the data.
and that's in part what I was saying. I think even a consistently applied method, but maybe not perfect, would be better than where we are today, where you really have to have someone like me on your team to be able to understand what the lab is doing.
Right.
And, I like to stay busy, but it shouldn't be that hard.
So let me close out the session with this question to each of you. And the question is, if you had the opportunity to sit in that science seat at that table, what is it that you would be asking for? Anybody can go first.
Okay, no, go ahead.
Preston?
Yeah, well, I would just like to reiterate the conclusion of the comment in the Drexel study that the data from animal studies and extrapolation of those just doesn't jive with data when you have 69,000 people who have been monitored for 7 years for health effects and you have their blood serum levels of these compounds. Look at that data. Look at the human exposure data and the human health effects data, at least to do a ground truthing of where you think you're going to end up on your with your regulations. And I think if you did that, the other thing is consistency. Given that New Jersey DEP kind of ran out in front, and I've looked at their analysis and how they got to their numbers. It's very conservative, but it would be helpful. It would be better than where we are now if the federal government just said, we're not going to reinvent the wheel. We'll just take New Jersey's numbers. They're probably ultra conservative, but at least everybody knows what the playing field is. You don't have states trying to outcompete each other to get to a lower standard.
Okay, thank you. Greg, Dave?
I'm
Amy?
gonna argue Dave's case. If you're out there looking in different media and you're looking water, fish, sediment, effluent, you name it, you need a standardized method. I mean, we learned that with the PCB TMDL. And that way we can look at all the sources at some point and say, okay, if we have to reduce, where are they coming from? So we have a standardized approach, a standardized method, and the data is comparable over time and space. We need that. EPA needs to get off the stick and do it. David's probably more familiar with where they stand on that. My understanding is they were getting close, and now you're telling me there's some questions. And this has been ongoing for what, 3 years now? I mean, so if you want to fill in a little more, please.
Well, before you do, I want David, you can close this out. Amy, what would you say if you're at that table?
Yeah, no, I think I would say my last point on my slides is new thinking. Be open to new thinking and new innovations to, look at PFAS compounds.
David, run us out.
Well, so as much as I would like to think the chemistry is the most important, I really think that we should be spending our money on good and meaningful tox studies and information. I mean, if our point is to protect human health in the environment, we should really start with what that protection level is. And so I've always felt that we spend our money in the wrong places. I mean, right now we're cleaning up at exorbitant dollar amounts. And I mean, let's face it, PFAS has been around for a couple of decades now. We're all exposed to it on a daily basis. And guess what? We're all alive. So, I think we need to go back to basics and really take a look at what is meaningful risk levels and tolerance levels for these compounds, and then figure out what to do about it. So.
Thank you. Interesting perspective. So we have 1 minute. I'm going to thank everybody and thank you all who attended. Skelly, thank you in particular for keeping us on track and making sure everything came together, and for environmental standards, for the credits that were available. And I hope you all learned a lot from this presentation, and we'll look forward to seeing you at another WRA session. Skelly,
Thank you.
anything more?
Thanks, everybody.
All right, thank you
See
all.
y'all.
Bye.
Bye-bye.